An overview of the most prevalent aphasias by Hannah Buckley and Sreya Sinha.
The extent of aphasia can be assessed by speech-language pathologists. Speech-language pathologists commonly use the revised Western Aphasia Battery to assess and diagnose aphasia. The test assesses the patient's ability in fluency, content, comprehension, repetition in naming, reading, and writing. An extended portion of the test is available to assess non-linguistic skills, particularly drawing, calculations, and block design. To obtain a speech sample, speech-language pathologists ask patients to describe a picture. This is the cookie theft picture from the Boston Diagnostic Aphasia exam.
First of all, this is falling down just about, and is going to fall down, and they're both getting ready something to eat. But the trouble is, this is going to let go, and they're both going to fall down. But already then, I can't see well enough, but I believe that either she or will have some food that's not good for you, and she's to go get some for her too, and that you get it, and you shouldn't get it there because they shouldn't go up there, and unless you tell them that they should have it. And so this is falling down, and for sure there's one they're going to have for food, and it didn't come out right. The stuff that's good for, it's not good for you, but you love it. And so I can't see whether it's in there or not. Oh, I think she's saying I want 2 or 3, I want 1. I think so, and so she's going to get this one for sure. It's going to fall down there or whatever. She's going to get that one, and there, he's going to get one himself or more. It all depends with this when they fall down. And when it falls down, there's no problem. All they got to do is fix it and go right back up and get some more. Oh my God. Wife is dry dishes. Water down. Oh boy. Okay. Alright. Okay. Cookie is down. Fall. And girl. Okay. Girl. Boy.
What is the boy doing?
Cookie is, catch.
Who's getting the cookies?
Girl. Girl.
Who is about to fall down?
Boy. Fall down.
There are 8 distinct classifications of aphasia, but clinical signs are rarely exclusive to one type of aphasia. The classifications are distinguished by their proficiency in fluency, comprehension, and repetition. Global aphasia is characterized by poor proficiency in all 3 areas. Global aphasia is associated with a large lesion damaging the left frontal, temporal, and parietal lobes. Receptive language abilities, expressive language abilities, and repetition are all lost. Patients are often mute or limited to basic sounds. Complete recovery is rare, but improvement is possible. The first 6 weeks following the injury are the most indicative of language prognosis. In some cases, global aphasia may improve to a level at which language deficiencies are only expressive or receptive, not both.
Deficiencies in expressive language and repetition are characteristic of Broca's aphasia. Broca's aphasic patients have difficulty with the production of language, especially spontaneous speech, articulation, intonation, grammar, and naming. A classic symptom of Broca's aphasia is telegraphic speech. Patients omit function words such as articles, auxiliary verbs, and pronouns. Broca's aphasia is Patients with Broca's have lost the ability to produce speech, but the intent of communication is still present. Patients often rely on gestures to communicate. Speech-language pathologists may recommend that Broca's aphasics use the picture communication system to communicate at home. Common therapy goals include regaining articulatory function, improving conversational speech, and improving word recall abilities. Wernicke's aphasic patients, on the other hand, have no trouble with articulation or conversational speech. Wernicke's aphasia is a receptive aphasia. It impacts comprehension, not production. Classic symptoms of Wernicke's include nonsensical, ungrammatical, and jumbled speech. Wernicke's is associated with lesions of the posterior part of the superior temporal gyrus. Carl Wernicke, who first described Wernicke's aphasia, also was the first to predict conduction aphasia in 1874.
Conduction aphasia is a rare aphasia caused by damaging the arcuate fasciculus, a white matter tract connecting the posterior receptive region with the premotor and motor cortices. Severing the structure does not severely impair language ability. The arcuate fasciculus is responsible for carrying linguistic information from the receptive area to the expressive area. When this structure is disturbed, receptive and expressive abilities remain intact, but the chain allowing repetition is broken. Language assessments prove that the conduction aphasics can hear and understand a passage, but when asked to repeat the passage, they cannot. With the exception of subtle paraphasias, or sound switchings, people with conduction.
Anomic aphasic patients possess good repetition skills, but lack in word recall ability. Recall loss is sometimes categorical. A person may only forget words related to a certain genre or hobby, such as photography or office supplies. Recall loss may also selectively affect word classes. Patients may only lose access to words that are nouns or words that are verbs. Lesions associated with anomia are usually found in the temporoparietal lobe, or as a result of damage to the angular gyrus. Anomic patients try to compensate for word loss by using elaborate constructions to get their point across. Their grammar is unaffected, and auditory comprehension is usually intact. Anomia can be a sign of a brain tumor, even if the tumor is not near language centers. Transcortical motor aphasia is a non-fluent aphasia, causing a reduced speech rate. Most utterances are 1 or 2 words long and are slowly pronounced with effort. Transcortical motor aphasia leaves language reception and repetition intact. The affected lesions are in the frontal lobe, anterior or superior to Broca's area.
Mixed transcortical aphasia occurs when there are lesions in both the areas responsible for transcortical motor and transcortical sensory aphasia. Mixed transcortical aphasia is classified as a fluent aphasia with poor comprehension, but good repetition.